Hey everyone, I'm Dr. Phil DeVasto. I'm here at Hosmer Chiropractic Health today. What I want to go over today is what we call the hip hinge. It's an exercise I'll give to a lot of patients to work on at home, especially if we're trying to loosen up hamstrings, if they have tightness or soreness in the low back. It's just the proper way that you should be bending is at the hips versus the low back, and we're going to talk a little bit about that and show you the exercise that you can work on at home. So when I'm talking about bending at the hips versus the low back, I'm just going to give you an idea of what both looks like. So a lot of times we'll see patients with low back pain, and maybe it's because they've been bending the wrong way for a long time, or maybe they bent over to pick something up the wrong way, and what that would look like would be bending at the back. So these joints here move, and it just looks kind of like this. You kind of just, that whole lumbar spine flexes forward. It's not a solid position to be in. Puts a lot of strain and stress through those joints. And especially if I was going to go to pick something up like that, when I have to come up here, we're asking these muscles to do a lot of work, and it's just not the ideal way to bend over and pick something up. So when I'm talking about hip hinging, what I want to see is that these joints here move first. And for that to happen, the butt has to move backwards. That's your first movement. So think about when you're going forward, the butt goes back, and then you're bending at this joint. Do you notice the difference? My back is completely straight, and I'm just bending back and forth at the hips versus at the back. And so it's kind of a tough movement if you're not used to it. So we have an exercise we're going to go over that is foolproof. The only way to do it is the right way. So you're going to need a dowel. We just use a piece of PVC here, but you could use a broomstick or something like that. And what we're going to do, we're going to stand with it. We're going to stand tall. We're going to put it behind our backs. And now first thing is we're going to get in good posture. So I want you to squeeze the glutes and pull the rib cage down. Now we're in nice neutral posture. And I'm going to hold this dowel behind me, and what we're trying to do is have it be in contact with us in 3 points. So it's touching my tailbone down the bottom, it's touching my spine in between the shoulder blades, and it's touching the back of my head. And now your goal is going to be to bend forward without the dowel leaving any of those 3 spots. And like I said before, the only way to do it is the right way. So we're going to get in a good athletic stance, feet are about shoulder width apart. We're going to squeeze the glutes, tuck the rib cage, and I'm just going to lightly hold that dowel there, and I'm going to practice bending forward. So again, you're going to lead with the hips. My knees are slightly bent here, and we're just going to go forward until you can feel a good stretch in the hamstrings right through the back. I get a good pull there on the hamstrings, and so I'm going to come back up, and that was 1 rep there, and that was what we call the hip hinge. So again, pushing the hips back until I feel the stretch through the hamstrings there. Maybe take a breath, feel that stretch through the back of the thigh, and back up. So what I'm going to go over now is some common faults. If I was to bend at the back, it would be really apparent because the dowel is going to come off of my low back. So if I went to go do this and I bent at the spine, you can see how the dowel just flies up forward. So that is what we want to avoid. We want to avoid any spinal movement. If I was to hyperextend in the mid-back, you would notice as I do that, it comes off between the shoulder blades, and that's another fault that we don't want to see. And the last one would be if I had any upper neck flexion of any sort as I went down, my head would come off. And then of course there's the neck's off, the back's off, and that's the worst of them all. So get a dowel, give that a try. Remember, the big thing is starting with good posture, having those knees slightly bent when you start, and the dowel does not leave the back on any of those 3 spots. We're thinking about bending right here at the hips. So again, hip hinging versus bending at the back. So give that a try and see how it feels.